Welcome back, my fellow Chiari warriors. This is week 12 of my recovery from decompression surgery that I had on April 9th, and this past week, 2 dizzy spells. So, knock on wood that continues to be the case, and hopefully get down to where there are 0 dizzy spells. My doctor and I explained this in an earlier video. You can go back and watch it if you want the full take on it, but basically this surgery can take time. It's sort of like if you move a piano that's been sitting on the carpet, it takes a while for the carpet where the piano was sitting to come back to what it originally was. So updates on my recovery, pretty much everything's going as well as can be expected. I have not had the opportunity to attend any amusement parks or any rides or anything like that, so I don't have any insight on, or I haven't traveled either, so I can't talk about riding rides and traveling as far as how that affects me with the surgery, so I can't give you any input on that. I did have a couple people ask questions in private messages on Facebook. One of the questions was, how do you deal with the anxiety regarding your results? So I'm guessing that you're talking about the anxiety of when you have the results and you're trying to decide whether surgery is the right option for you. Because once you had the MRI and you're waiting for the results, you can worry all you want, but there's nothing you can't change anything. Whether you worry or whether you don't worry, the results are going to be the results. I know that's easier said than done, but that's what I just tried to tell myself when I was waiting. And then I got the call 3 days. Well, actually, I got the call on a Monday. I got the imaging done on a Friday. Monday morning, my neurosurgeon was calling me to say, we need to get you in. And that's when I found out that I had a Chiari of 18 millimeters. So as far as anxiety goes, waiting for the results, that's the best advice I can give you. Now, once you've gotten or received the results and your doctor has offered you surgery, there might be some anxiety there. The best thing I can tell you, what helped me, is I sat down with my family and we discussed the pros and cons, basically, of the surgery. As with any surgery, there's always the risk of complications. And in fact, my incision became infected, so I had to go back in. I had to have surgery. They had to clean it out, and then they stitched it back up. Everything's been fine since. So things like that could happen. You ultimately have to decide. You got to make the decision that's right for you. It's your head. It's your brain. It's your choice. And if you choose to go with the surgery, you've got to be able to live with the decision. If you think surgery is the right thing to do, then go with it. You do need, though, to discuss it with your family and let them know that they are going to be responsible for taking care of you during your recovery time. Because I would say for me, the first 5 weeks were rough. First 3 weeks were really bad. You can't, it takes forever to walk from one end of the house to the other. You are using a cane or a walker unless you're Superman or Superwoman or something like that. Of course, I'm 51, so I'm a lot older than a lot of people that typically, I guess, are diagnosed or whatever with Chiari. I was told that usually people in their 30s, tend to recover faster than people in their 50s. But your family is going to have to pick up the slack for you, and they're going to have to take care of you. Those days of, I'm just going to walk to the kitchen and grab a sandwich and come back and sit down and watch my show. Try carrying a plate while you're using a cane. It doesn't work. Because I would have to reach out and grab something with the hand that I wasn't, that the cane wasn't in. So you're not going to be able to carry things. So you're going to have to bring everything to you. So I guess back to the anxiety, you've got to look at it as, how is this surgery going to help you? So I would suggest that you ask your doctor to give you a percentage as far as what percent chance does he or she think the surgery is going to help you. My doctor told me, I'll be honest with you, it's 50-50. But I will tell you this, I never offer surgery to a patient of mine that I don't think that there will be benefit. And that put my mind at ease. You know, he was being straight with me because he said, I can't guarantee that it's going to help, because he wasn't exactly sure about my CS, you know, about the flow, because yes, I had a herniation, or, you know, I had a Chiari of 18 millimeters, but the flow didn't seem to be as restricted as he had seen in other patients with an 18 millimeter Chiari. So that was the reason why he gave me a 50-50 chance, but he said that he would offer me the surgery because he did think I would see benefits. Find out what your doctor thinks, and then you've just got to make the choice that's best for you, but involve your family, get their input. It can never hurt to have someone's input, because someone in your family might come up with a thought or a way of viewing the surgery that you might not have thought of. So I hope that is helpful to those of you that are trying to deal with the anxiety. I don't want to say use your family, but you have to rely on your family, or rely on the people that are going to be your primary caregivers, because they're the ones that are going to be taking care of you, and they're the ones that are probably going to give you the honest information. They're not going to, you know, sugarcoat things for you. They're going to tell you what they think. And when you're having a situation like this, which is the major surgery, obviously, you need somebody who's going to, you know, not candy coat things. As I said, they're going to tell you what they think and how they feel. Another question I received, I just thought I'd tack it on to this video, so I know this video is going a little bit longer. The question was, how do you deal with headaches? And when you come out of surgery, how do you deal with constipation the first week or so? I did a video on how to deal with the constipation, so you can go back and look at that. I will tell you it involves Miralax. But back to the headaches, because I'm doing this on my phone, so it's going to take an eon for it to upload. The headaches, what I found worked best for me is I would get one of those ice packs, the blue ones that, you know, you could bend, that had a little flexibility to it. And I would wrap that around the portion of my head that was where the headache was the strongest. So I know sometimes some of you are saying, well, it's the whole head. Well, then I would wrap it over the top of my head in that case. But I would wrap it around and try to secure it with a towel. It didn't look very stylish, but it helped feel better. Some people say Excedrin, Aleve. I found that aspirin helped me. Ultimately, you know, you're going to have to, you know, your doctor might be able to prescribe you something that will help with the headaches. A lot of people talk about vomiting. You know, how do you keep, you know, from feeling nauseous when you come back? For me, Phenergan works great. Whatever that other stuff they were trying to give me in the hospital, they kept trying to push on me. It wasn't working. I felt nauseous, you know, 2 hours after taking it. So finally, when I told them, I said, look, I'm not taking it anymore. I want Phenergan. Everything was fine. The point I'm trying to make is everybody is different. Medications are going to affect you differently. But I found aspirin and an ice compress, you know, wrapped a towel around my head. That was the biggest help. Some people, heat never helped me. So I don't know. I mean, maybe it'll help you. But those were the two questions that people had asked me on Facebook. So I wanted to address those in my weekly update video. Please, if you have any other questions, put them in the comment section down below. Please like this video and subscribe to this video. Maybe do that in the other way around. I guess it doesn't really matter. But I'm trying to build this channel. I'm trying to reach more warriors out there. So if you wouldn't mind doing that, that would be a great help. Share this with your friends out there. And until next time, until next week, take care of yourself. Later.